Miracle drugs, breakthrough medications. We live in an era where prescriptions are no doubt game changers for a higher quality of life. Every day, pharmacists depend on measuring out small quantities of drugs using hand counts and electronic pill counters. And while this is fine for smaller venues, it would be impractical for today's large healthcare facilities, causing confusion, lack of medication availability, and waste. In 2012, AlixaRx, a company founded by an expert group of medical collaborators, sought to transform medication management in long-term and post-acute care facilities. They introduced a proprietary automated dispensing unit, or ADU, along with an electronic medication cabinet, EMC, to provide on-site access to over 300 medications in facilities across the United States. Each month, their technologies deliver millions of capsules, tablets, liquids, inhalers, syringes, IVs, and other critical medications to over 25,000 patients across the country. A key leader of AlixaRx since its inception is Brad Savage, Senior Vice President.
The traditional pharmacy model hasn't really changed in 30 years. With the advent of AlixaRx and the technology we provide with our automated dispensing unit and electronic medication cabinet, provides a huge advantage to those facilities. We give them the on-site access that they need, effectively putting a pharmacy on-site in their facility.
Creating a total medication management solution requires three important parties: the on-site pharmacy dispensing system, located at the healthcare facility, the pharmacy hub that refills and services the dispensing system, and CRETEM, the manufacturing facility in Korea that produced the dispensing technology. Here at Salud, a rehabilitation facility in Georgia, the proprietary technology from AlixaRx is not only cutting costs, but also making medication management safer and more effective for both patients and staff. Every patient's name and medication regimen is kept in the electronic database. Nurses operate the dispensing units to retrieve the exact type and dosage of medication needed on a patient-to-patient basis. If something other than a tablet or capsule is needed, such as an IV or refrigerated item, this is kept in the electronic medications cabinet. Both the ADU and EMC are only accessible by the nurse. Once all the medication for each patient is dispensed, the nurse makes her rounds and delivers the medication to each patient.
The AlixaRx helps us improve the care of patients by allowing us to get the medications. If there's a stat order, we can go pull it out of the machine quickly, dramatically decreasing rehospitalization rates for our patient to have to go back to the hospital. It also decreases costs because we're not ordering a 30-day or a 60-day supply of medication. We get one pill at a time as the patient needs it.
Once the on-site dispensing system is active in the facility, it must be maintained, refilled, and managed by an AlixaRx pharmacy hub. Pharmacists at this hub in Atlanta refill the dispensing canisters for Salud and many other facilities, ensuring there is never a shortage of medication.
With many different medications being prescribed, we're constantly looking at the formulary so that we have all of the right inventory and access that they need on-site.
Pharmacists also maintain the patient's medication profile that is sent to each ADU and EMC, as patients, dosages, and medication protocols are constantly changing.
Having the AlixaRx technology here greatly helps our patients by reducing needless rehospitalizations. For example, over half of our patients here are post-operative and have a lot of pain needs, and having those pain medications instantaneously available greatly diminishes the chance that they may need to go back to a hospital setting for acute care and needing more intense pain medications.
The foundation for the relationship between the pharmacy hub and the facilities lies in the engineering and design of the technology. CRETEM, a Korean-based manufacturing company, created the cutting-edge dispensing units and the technology behind the intelligent medication dispensing system in partnership with AlixaRx. They have designed the dispensing system to fit into the space limitations common to most healthcare facilities, while delivering the value of a pharmacy on site.
저희 크레템의 오토매틱 프리스크립션 패킹 시스템은 기존의 대형 병원이나 약국에서 사용되고 있는 조제 시스템과 차별화된 무인 조제 시스템 개념입니다. 알릭서와 4년에 걸쳐 공동으로 개발한 소프트웨어와 새로운 첨단 기능이 포함되어 라지 헬스케어 퍼실리티의 최적화된 시스템입니다. 이 새로운 무인조제 시스템은 현재 미국 골든이병 요양원 250군데에 성공적으로 설치 운영되고 있습니다. 이러한 기술들의 발전으로 미래는 환자가 약이 필요한 경우 가정 혹은 집과 가까운 곳에서 무인조제 시스템의 도움을 받아서 보다 안전하고 질 높은 서비스를 받게 될 것입니다.
In long-term and post-acute care facilities, medications are essential to helping patients experience better outcomes and enjoy a higher quality of health and life. With the dispensing technology, long-term and post-acute facilities can experience significant cost savings. Nurses and caretakers have easier access to prescription needs, and the amount of waste is greatly reduced.
With the quick access to medications, we're able to give them to patients who may need something stat, who may have had a decline in their health, that we could keep them here by giving them these medicines within 5 or 10 minutes, as opposed to having to wait 4 to 6 hours, send them out to the ER, have them come back. It's a safe system.
In any healthcare facility, it takes a coordinated team of doctors, nurses, pharmacists, and others to make sure each patient's unique needs are met. To support this patient-focused team, AlixaRx and CRETEM are transforming medication management by providing innovative technology that improve patient outcomes, reduce cost, and increase efficiencies.